So in this chapter, we are having biological therapies in the beginning. Biological therapies. Some therapies are psychological, some therapies are biological. So let us discuss initially biological therapies. Screen is visible? The
Yes, sir.
presentation. Okay, very good.
Yes, sir.
So biological therapies. What are biological therapies? What are psychological therapies? Suppose a particular disorder is having biological cause, medical cause. For that, we use biological therapies. So, in our book, we are discussing particularly 3 types of biological therapies. The first one is drug therapy. That means chemotherapy. And electroconvulsive therapy. That is ECT. And psychosurgery. Surgery to some brain parts. So these are all related to biological therapies. So what is a drug therapy? So drugs are having chemicals, no? So those chemicals, doctors will prescribe to alter in the body imbalance. Normally, this drug therapy is used for ADHD, depression, schizophrenia, Tourette syndrome, anxiety disorders, autism, panic attacks, and obsessive compulsive disorders. So these are all the disorders coming under drug therapy. So in these drugs also, there are some psychoactive drugs. Some are antipsychotic drugs. Some are antidepressants. Psychoactive drugs and antipsychotic and antidepressants. These are all the normally in drug therapy, the psychiatry doctors will prescribe according to the client condition. Okay. Next, electroconvulsive therapy. Electroconvulsive therapy is nothing but giving electric shock to the psychologically affected person. In this statement, what they will do, doctors will put some electrodes to the head and they will pass some 70 to 130 volts current for a few seconds only. But normally this they are using for depression and schizophrenia patients. But ECT is not much preferable nowadays, but because it is giving some side effects, because people are losing, after therapy, people are getting highly irritated. Some people are losing memory and the response rate is very slow for some people. So because of some negativity, much people are not preferring this electroconvulsive therapy. Next, psychosurgery. Normally, this is related to a brain surgery. to attend some neurological problems in the brain. And psychosurgery is also, for some people, the success rate is somewhat 30 to 60% only. 100% it is not successful in all the cases. Because psychosurgery became a final method of treatment when every treatment failed. See, before going for psychosurgery, they are going for so many methods of treatment. After seeing all the treatments, nothing was worked. Then only they are thinking about the psychosurgery. So far we discussed these biological therapies. First one is the drug therapy. The second one is electroconvulsive therapy. The second one is psychosurgery. So out of all these, more preferable is a drug therapy for certain conditions. The balance to ECT and psychosurgery are only the last options for people after trying so many methods of treatments. So in this chapter, we are having non-biological therapies also. In these therapies, they don't use this type of giving current shock or doing surgery or giving some drugs. Only this is related to correction of maladaptive human thoughts. So that is the reason they are calling non-biological therapies. So here, some non-biological without medications. One is brainwave therapy. In brainwave therapy, meditation is also one type of brainwave therapy. So here, this therapy, one way it is observing how the frequency of our brain waves is happening in our brain when we are in different conditions. When we are in very sleepy mode or somebody is in so anxious mode. So our brain activity, how it is there, the people will observe through EEG equipment. Somebody making noises. Please, everybody mute. Please. Okay. So in our brain, different waves are there. The different waves are having different frequencies and different rhythms. So I think you are seeing in your textbook also it is available. When we are wakeful, alertness, and having some fear or anxiety, the waves severity is somewhat higher side. The frequency is more and rhythm wise it is also more. That is called beta rhythm. Like that, you can see here, alpha rhythm is there, theta rhythm is there, delta rhythm is there. Ultimately, the people, those who are doing regularly meditation from long days, so during meditation, they will achieve the third or fourth options normally. Theta rhythm or delta rhythms. These are very calm state of the mind. But when we are anxious, definitely a person is feeling anxious and highly alert because of some fear, the frequencies are high. So to bring the state of control in the mind, people are practicing a meditation particularly. So this is one type of making people calm. People are having more highly alert and fear and anxiety. Some people are still following this meditative type of activities. And you can also hear the brain waves, how they are, that you can see by neurobiofeedback machines are providing people. Neurobiofeedback machines. By connecting some sensor to our head, you can see how the brain waves are moving. In the computer screen, you can see. By seeing the waves, by doing some practices means listening a very beautiful music or doing meditation.
Sorry, where we can see these rhythms? Where we can see these
In
rhythms?
computer screen during neurobiofeedback's system machine, we can see on computer screen.
Okay, it's a separate machine. All right.
That is called biofeedback.
Biofeedback. All right. So while doing binaural bits, we can see that, right?
Yes. So this is called brainwave therapy. And second one is cognitive therapies. This is now presently dominating in our psychological field more. Because the earlier all therapies doing by other professionals. We are not doing most of the, because ECT we can't do, brain surgery we can't do. Okay, and the chemotherapy we cannot do. And this brain therapy also we can, if you have that biofeedback machine, we can do. But what a psychologist is possible thing is cognitive therapies. Actually, this therapy system has come in 1950. In 1950, the first therapy is behavior therapies. That is the reason this behavior therapy is called first wave therapy. The behavior therapy, first therapy is REBT, rational emotive behavior therapy. So this was developed by Albert Ellis. And in cognitive therapy, the second therapies came into operations, particularly in 1960 time by Aaron Beck. Because Aaron Beck has thought, for every behavior, just by behavior modifications, we cannot alter. For every problematic behavior, behind there is some cognitions, some thought process. So because of that wrong thoughts or maladaptive thoughts or cognitive distortions, those things only causing this behavior. So unless we control those maladaptive thought process, we cannot control the behavior. So this philosophy explained by Aaron Beck in 1960. So he developed this cognitive behavior therapy. If you want to control your behavior, you have to go back to the causes, for the behavior causes. He is thinking the causes are thought process. So we have to identify those thoughts. We have to control those thoughts. We have to alter those thoughts. Then only this behavior will control. So like that, this Aaron Beck proposed CBT theories. This is second wave therapy. In 1960-65 time, those therapies has come. Recently, in 1985, 1990 time, third generation therapies has come. In 1950, first generation by REBT, that Albert Ellis. The second generation therapies came in 1960-65, Aaron Beck, that is cognitive behavior therapy. And the third generation therapies entered into the world by 1985-90 time. Those are called acceptance and commitment therapy, dialectical behavior therapies, and mindful-based cognitive therapies, like that. 3-4 therapies has come as third wave therapies. So now in this non-behavioral, non-biological therapies, we are concentrating mainly on 2 therapies in our textbook. That is REBT and CBT. These 2 therapies we are concentrating here. So let me read. Cognitive therapy is a psychotherapy, is a procedure in which a trained person establishes a special kind of relationship with an individual seeking help. The person who is seeking help and the therapist and the client will establish a good relationship. For establishing relationship also, Carl Roger in humanistic therapy has explained 3 basic conditions. If a therapist apply those 3 basic conditions, particularly in therapy sessions, then only the good relation will form. The good relation means therapeutic relation will form in counseling. What he said, Carl Rogers, those 3 main conditions. The therapist has to exhibit empathy towards client. Empathy. And the therapist has to maintain congruence. And the third one, unconditional positive regard. Without any conditions, the therapist has to accept the client. Then only the good therapeutic relation will happen. Because of good therapeutic relation, the client believes, the client will feel this is very safe place for me to solve all my problems. Then only by feeling safe, the client will try to explain all his problems and causes also. So that is the reason Carl Roger suggested therapist has to maintain the basic 3 conditions. So here we will discuss what is cognitive therapy, what is rational emotive therapy. The basic idea behind cognitive therapies is that many psychological disorders are the result of faulty or distorted models of thought. Many psychological problems causing by distorted modes of thought process. When a person can change those faulty thoughts, then only he will get rid of those disorders. So psychological theory is saying the same thing. The faulty thoughts, the irrational thoughts, which are not rational, if we identify and change those thoughts, then only the person will come out from that disturbances. So here, basically we are having 2 main therapies. One is rational emotive behavior therapy, REBT. This was proposed by Robert Ellis. And cognitive behavior therapy proposed by R.N.T. Beck. R.N.T. Beck last year only he died. In 2023 he died, R.N. Beck in America. So let us discuss briefly what is REBT, what is CBT, because to discuss elaborately a therapy, it takes a lot of days. Within this 1.5 hour time, only briefly we can discuss. We cannot go in depth now. Time constraint is there for us. So Basically, you can understood what is REBT. Human beings are born with potential for both rational and irrational thinking. So the people are thinking, some people are thinking sometimes rationally, sometimes thinking very rationally. People have predispositions for self-happiness, thinking, and loving others. Naturally, we are all having, by genetically predisposed for self-happiness, thinking, and loving others. And same time, other quality also we are having. They also have propensities for self-destructions, endless repetitions of mistakes, and self-blame. We are having both conditions. Self-destruction we are having, and self-happiness also we are having. That is the reason even Sigmund Freud also says Eros and Thanatos in his theories. People can create self-happiness and self-destruction by doing the repetition of mistakes. Taking that for granted, and humans are capable. Some people are taking granted good behaviors. Some people are taking distractions as good behaviors. So when people exhibiting the problem comes only with distractions, endless repetitions of mistakes, or themselves blaming. People getting blamed by themselves. So here REBT attempts to help them to accept themselves as creatures who will continue to make mistakes. So here REBT, what it is saying, we are all human creatures and will continue to make mistakes, but at the same time live more at peace with themselves. So for basic understanding purpose, I am telling about this actually. Now REBT, how it works. REBT is based on the premise that although we originally learn irrational beliefs from significant others during childhood, irrational beliefs we are learning from our culture, from our childhood. So those irrational beliefs ourselves we create. We do this by actively reinforcing self-defeating beliefs by the process of auto-suggestion. Auto-suggestion means giving suggestions by ourselves only. This is only correct method, what I learned from childhood. So that much belief they are developing from childhood. So the same belief they are repeating. Okay, in our textbook also they given very clearly. If you have time, you can read. REBT works under a framework of ABC. In your book also they given like that. ABC. A means one event. B means belief. C means some disturbance or consequence. Here, one activating event, because of the person belief, the consequences are happening. The problems he is developing. Suppose there is an example, I will say one event. So So people are perceiving the same event differently. Different people are perceiving differently, but the event is same. Some people are perceiving the event is very good. Some people are perceiving the event is not at all good. So this is all happening because of our perceptual issues. If people perceive some event is bad, because already they formed a belief from their childhood, this type of behavior is bad. Some people perceived this type of thing is okay, normal. So here, the major problem playing activity is the belief, how a person is believing. So the belief only creating more problem here, not actually the event. In your book also they given like this very clearly. One example in your book, page number, I think 249, ABC framework is there. If a person experiences depression after a divorce, normally people will experience some type of pain, sadness, or depression. For example, the person is feeling the depression not because of divorce, because he believed, his belief is the divorce happened because of his failure. So because of divorce, he will be not accepted in the society. So that type of belief has caused much him to feel depressed. Not the major cause is not the divorce. The what belief he is having about I may be in the society not accepted, I am not a good person, that is the reason my wife has left from me. So that type of belief he is having. That belief only causing him more pain, more depressed, not the event of the divorce. So here the problem is belief. So in rational emotive behavior therapy, unless you change the belief system, first thing, this type of starts developed because of what? Because this was developed by some belief the person is having. So we have to identify the belief system and we have to dispute the belief system. We have to prove this belief is wrong. This belief is not correct. Here the therapist job is how to dispute the belief system is important. Then only the client will understand what I am believing is wrong. The problem is only the belief, not the divorce. So the ABC framework will become ABCDE. A means activating event, B means belief, C means consequence. The consequence is here depression. But what therapist is saying, the belief system you have to dispute. Disputing means D. Okay. And E means some new feeling he will develop. Because of disputing, he will get some new feeling. That means effectiveness. So the rational emotive therapy is suggesting unless we change the belief system, the person's problems cannot be attended properly. So this was given very clearly in your textbook also. You can read further to clarify your doubts. So any discussion up to this?
If belief system is very strong, like the person is psychology student might be, or whatever any reason, he already aware that they're gonna do this, they're gonna destroy my belief system. So what approach will be applied in this case?
See, we have to think about, there is a rationality and irrationality. In belief system also, rationality is important. And irrational beliefs only creating problems. We have to check the belief system is rational or irrational. So there only the therapist will help to the client about the irrationality of the belief. Then only the client will understand the irrationality in the belief. He will make it rational way of thinking. Then only he will try to change. Then only he will modify his belief system. So here the important thing is irrationality identifying in the belief system.
Okay, sir.
Okay, thank you. And next, CBT, cognitive behavior therapy. So I told cognitive behavior therapy developed by R&Beck. So what he told, he revealed that people have negative bias in their interpretation of certain life events. Naturally, no? Many people, even we, sometimes we wrongly interpret certain events. See, we are moving on the road. Their two friends are standing, they are having discussion. They started laughing. The person moving on the road, by seeing them, he thinks they are laughing by seeing me only. So he is wrongly interpreting the event. Because of wrong interpretation, he is having negative bias. So this type of thing, negative bias only contributing for the cognitive problems. Earlier also we discussed what we are seeing is not the real. For that behavior, there are some causes. Those are thoughts. So cognitive therapy pursues psychological problems are stemming from process of faulty thinking. What R&Beck is saying, cognitive problems are developing or stemming from process of wrongly thinking and making incorrect inferences on the basis of inadequate or incorrect information. We are believing the faulty thinking process only. Why means making incorrect inferences. అది నిజమనే నమ్ముతున్నాం మనం. We are believing these thoughts are correct, but without any basis of facts. That means incorrect information only people are believing and people are failing to distinguish between the fantasy and reality. So because of this type of faulty thinking only, because of incorrect inferences about the event, or people are having incorrect information, we are failing to distinguish between the fantasy and reality. So this unable to distinguish between fantasy and reality only creating the mental health disorders. So this theory explained by Aaron Beck. And next you see, cognitive therapy refers to collaborative empiricism. Collaborative empiricism means wherein therapist works together with clients to help them discover for themselves the maladaptive nature of their automatic thoughts. Here, in cognitive behavior therapy, the therapist will collaborate with the client. He will help to the client for identification of maladaptive, wrongly thoughts, abnormal thoughts. Only therapist will help to the client for identifying maladaptive nature of automatic thoughts. Then only by identifying the automatic negative thoughts only, if you identify, then only we will try for changing those thoughts. First, we have to identify. The client is having automatic thoughts, negative thoughts only. But we have to identify what are the negative thoughts. After identifying, there are different techniques to alter those thoughts. In cognitive behavior therapy, there are a number of techniques available for altering of thoughts. If we alter the thoughts, then only the behavior will change. So here, very important thing is, the therapist role is, the therapist has to help to the client to identify the faulty thinking process. After identification only, the client will understand properly, then only he will try to alter his thoughts. For altering his thoughts, there are so many techniques available in cognitive behavior therapy. Okay. And cognitive theory believes in the individual organism processing of environmental stimuli as the driving force determining his specific responses. So this is the basic understanding of cognitive behavior therapy. And Aaron Beck, how he described the believing thoughts creating problems. We are getting so many thoughts on day-to-day basis. Even without our permission, thoughts are coming to our head. But the problem is, most of the thoughts we are believing without confirming the facts. Without confirming the facts, we are believing means, because of believing, our behavior is changing towards others. So the problematic thoughts we have to identify. The distorted thoughts we have to identify. That is the major help doing by therapists in CBT therapies. And here, cognition is core of human suffering. Cognition means the thought process. The thinking process is the core of human suffering. All humans are suffering because of wrong thinking only. Without finding any facts, we are just believing those thoughts. The therapist's job is to help clients to identify and modify distress-producing thoughts. The therapist's job is helping clients by identifying those wrong thoughts and modifying which are causing distress. That type of thoughts modifying is the main responsibility of the therapist. And suffering only due to believing the automatic negative thoughts, intruding into our brain, into our mind, and believing them without facts finding. This is our human weakness. We are mostly negatively biased. Without finding any facts, most of the people believing whatever their thoughts are real. That is only creating psychological issues, pain. So finally, what he says is, Aaron Beck and everybody, all psychological therapy people are saying, suffering is not compulsory thing. Suffering is not compulsory thing, and it is optional in personal life. If we think every thought is correct, every thought is real, definitely we will suffer. So suffering is here not compulsory. Suffering is a optional thing. Same thing was explained by Aaron Beck, but in CBT is a umbrella term. Under CBT, there are different methods of therapies are available nowadays for different issues. So people, those who are having interest in cognitive behavior therapy, so they have to do some hard work on these all therapies. Only knowing about CBT, only cognitions, faulty cognitions, identifying, and we can modify the person thoughts. That is only the way of thinking, but until unless we are having proficiency in all types of therapies, then only we can work like a successful counselor or therapist. And one more thing here. We discussed the basic things in REBT and CBT both. But there is certain difference is there between these two. The difference between REBT and CBT is Ellis means REBT. Ellis forcefully eradicates the irrational thoughts. So what in REBT, Robert Ellis, what he is saying, by identifying the irrational beliefs, you have to challenge those irrational beliefs. You have to dispute. This is an irrational belief. That means, one way, it is a forceful thing. That is the reason Ellis forcefully eradicates the irrational thoughts. బలవంతంగా డిస్ప్యూట్ చేస్తాం కాబట్టి ఫోర్స్ఫుల్గా మనం దాన్ని తగ్గించాలని చూస్తున్నాం ఇక్కడ. And Aaron Beck theory collaborates with client to identify and modification of maladaptive thoughts. That is the reason the CBT, cognitive behavior therapy, is dominating in society, because this therapy will identify the thoughts, the faulty thoughts it will identify, and it will modify for changing the behavior. Okay, any doubts in these two, REBT and CBT? What you understood?
సార్ REBTలో బలవంతంగా అది థాట్స్ ని కామ్ చేస్తే మళ్ళీ అంతే పవర్ తోటి మళ్ళీ రైజ్ అవుతాయి కదా సార్?
అట్లా కాదండి, ఇప్పుడు వీఆర్ డిస్ప్యూటింగ్ అనమాట, దాంతో ఆర్గ్యూ చేస్తున్నాము ఆ బిలీఫ్ తో మనము. వీఆర్ ఆర్గ్యూయింగ్ దిస్ ఈజ్ ఇర్రేషనల్, దిస్ ఈజ్ నాట్ కరెక్ట్, ద వే యు ఆర్ బిహేవింగ్ ఈజ్ నాట్ కరెక్ట్, దెర్ ఈజ్ ఎ రేషనల్ బిహేవియర్ ఈజ్ అవైలబుల్, ట్రై టు అండర్స్టాండ్ ద రేషనాలిటీ. Like that, we are disputing the faulty beliefs.
Okay, sir. Okay, sir.
And anybody? Or we will proceed to further. That is the reason I am asking.
Yes, sir, you can proceed, sir.
Thank you. Are you following at least what I am explaining today?
Yes, sir.
Yes, yes, sir.
Because it is very deeper subject. In one session, you can't understood. Even though if you read books, you will get lot of doubts. Unless you done some training period with some therapist or with some person, counselor, then only you will understand better. So otherwise you have to read lot of books and with some examples. Then it is okay. You can learn many things. So we are saying CBT therapy only helping to change the maladaptive thoughts. Maladaptive means maladaptive, wrongly adapting, wrongly understanding. Those thoughts only creating problems. Na? Some examples I am giving. What are the maladaptive thoughts? Just you read. I know I will make a mess of this job interview. That is one example of maladaptive thought. The person is expecting a worst thing. Before attending an interview itself, he is expecting a worst thing may happen in my interview. How? I know I will make a mess of this job interview. With that hope, he is going for interview. He is expecting without attending interview, worst thing may happen in my interview. Is it a right way of thinking?
No, sir.
Oh, sir.
But
No,
in
sir.
real life, we are thinking like this anytime.
Sometimes, sir.
Yes.
Sometimes, and sometimes opposite, they feel overconfident.
Yeah. And next, feeling that you should do everything perfectly. Feeling that you should do everything perfectly. Here the most problem is should, you must, you should. That means what it is saying, these two words, compulsory.
Compulsory.
So those two words are very bad in our life, really. Those two words creating most of the problems in our thought process. Here, the example what I am saying, you see, feeling that you should do everything perfectly. How it is possible everything doing perfectly? In real life, is it possible? If we do 100% perfectly, 100 by 100 marks we will get now. So this type of thinking is wrong thing. And one more example. I have to cook a perfect dinner for this time. I can't make a mistake like I did before. I will feel like a fool. See, in cooking, sometimes small mistakes will happen. How we are perfect 100 times in cooking? This is also one type of maladaptive thinking process. And another example, thinking that it is a catastrophe when things do not work out the way you want them. So everything, whatever you are thinking, in that way only it should happen. Everything, whatever you are thinking, that means whatever I think, it should happen. Our politicians are thinking, I have to win. Are they winning? No. And it is horrible that I did not find a job today. It's horrible that I did not find a job today. Okay, how it is horrible? You didn't find a job today. Tomorrow you may get, no? Or day after tomorrow you may get. How it is horrible? Just with one attempt, anybody will get job? No. And next, putting yourself down. I am such a loser. The person himself is assuming if he don't get a job, putting himself down, I am a loser. He is feeling depression. and thinking that your past will determine your future. I messed up so many times before, the future is hopeless. Ante, earlier we have done some mistake means every time we will continue same mistake. Thinking that your past will determine your future. How? Somebody is failing examination, that means he will fail always. No. These are all faulty thinkings. And next, things must go the way you want to them. They have to do it my way only. Not possible. And overgeneralizing. She never listened to me. Although one time she didn't listen, the person is saying she never listened to me. She never listened. Overgeneralization. And here personalizing. How the person will personalize the things. Thinking everything is all about you. Something happened. It was happened because of me only. It was happened because of me only. That means he is personalizing. So things personalizing and overgeneralizing, these are all causing psychological problems to the people. These we are calling cognitive distortions. So cognitive distortions will create so many psychological problems. So this is the first chapter in the last block, that is biological therapies and non-biological therapies. Clear? If any doubts, please rise now.
Sir, there are so many cognitive behavioral therapies out there, na, sir.
Yes.
Can you suggest me some books to read regarding this? In depth.
Cognitive behavior, acceptance and commitment therapy is the best one. Acceptance and commitment therapy, dialectical behavior therapy. Dialectical behavior therapy, Marsha. The book was written by Marsha. And acceptance and commitment therapy written by Heiss. You can read those type of books.
Okay, sir. Thank you.
And any doubts, or we go to other topic? You want any explanation about this?
No, sir, you can go ahead.
Okay, thank you. We will go to next topic. One minute. Now, we are going to second topic. Behavior modifications 2. Okay. So far we discussed biological therapies, non-biological therapies. In biological, we have discussed 3 types of things. The chemotherapy, that means that the drug therapy, and psychosurgery, and ECT. And in non-biological, we discussed about brain wave therapy, and cognitive behavior therapy, and rational emotive behavior therapy. We have discussed all these things. So those are, if you are perfect, are helpful for modifying the behaviors of the people and reducing the vulnerabilities of the people. Okay, now we are going to discuss about behaviors. So there are so many problematic behaviors we are observing with others and family members, and even most of the thing in children. So those behaviors we have to modify to right ways to correct all the wrong behaviors we have to modify. Shall I continue?
Yes, sir.
Okay.
Yes, sir.
Behavioral modification is the use of empirically demonstrated behavior change techniques to increase or decrease the frequency of behaviors, such as altering an individual behaviors. If we find some wrong behaviors with somebody, definitely we have to change those behaviors. So there are some techniques. Those techniques will increase some behaviors. Those techniques, some techniques will reduce the behavior also. Both are important. Reducing is also important and increasing is also important in behavior modifications. How? And reactions to stimuli through positive and negative reinforcement of adaptive behavior. The reduction of behavior through its extinction, punishment, or satiation. In behavior modification, the very important program is applied behavior management. So here, there are 5 theoretical approaches in behavior modifications. I think in your book also, they have mentioned all these things. One technique is counter conditioning. It involves desensitization technique and aversive techniques. And the second one is reinforcement response steps related to reinforcement techniques. And the third one is by doing modeling. The fourth one is token economy. The fifth one is assertiveness training. By using these type of techniques, we can able to modify the problematic behaviors. So one by one, we will try to understand. Counter conditioning. Earlier, we are all studied Ivan Pavlov theory of classical conditioning. Okay. By doing conditioning, we can elicit some behavior by doing classical conditioning. That is classical conditioning Ivan Pavlov developed. Here, counter that conditioning, doing opposite. An example of counter conditioning with systematic desensitization is helping someone overcome a fear. Here the problem is fear. How to overcome the fear? By doing systematic desensitization, we can overcome fears. Definitely, it is possible. Here the example is, someone might be afraid of scorpions. Normally, everybody is afraid of scorpions. The individual could practice breathing and relaxation techniques while looking at pictures of scorpions. In this behavior modification system of systematic desensitization, because of fear, the person is producing some anxiety. To reduce his anxiety, the person has to practice relaxation techniques. By practicing relaxation techniques, he can reduce his anxiety. By reducing anxiety, by applying exposure therapy about the scorpion, the person slowly, gradually will reduce fears. I will give a very general example. Some people are fearing looking the ground from second floor of a building. Some people are there, by looking from second floor itself, looking down, they fear like anything. Some people will fear by looking from fifth floor. It varies from person to person. He is having the problem of fear. So that is the reason he don't go to that floors. Only he want to work on the ground floor only. How it is not possible always. So we have to attend the fear symptom of the person. So here, what they will do, systematic desensitization, because the person is very sensitive about heights. First floor, second floor, third floor, floor by floor, the height is increasing. The person is very sensitive about heights. Looking from height is very sensitive, is very fearful. So here they will use exposure therapy to desensitize the fear. Suppose the person is afraid about looking ground from third floor. In exposure therapy, first they will ask him to look the ground from first floor 2-3 times or 2-3 days. Initially, he will have some fear because of daily he is getting exposed. Looking from first floor, day by day, the fear will get desensitized. Day by day, the fear will get reduced. Suppose if the fear is increasing means, to that person, he has to do relaxation technique till his fear has reduced, till his anxiety has come down. So after some days, looking from first floor, it will become very normal for that person. So first floor has normalized. Then the person will go to second floor. Same practice for some days. There also he will get normalized. Like that, number of floors they will increase slowly, slowly. Initially, which is the creating less anxiety, from there only we have to try. See, instead of trying directly from fifth floor, more anxiety creating situation, it is better to create a situation from first floor which is creating less anxiety to the person. So in hierarchy manner, step by step, we have to increase the exposure floor wise. Then his fear will get desensitized. One day he will become very normal by looking the ground from fifth floor. So he is getting conditioning. It is happening. Earlier he is having fear. Now he is countering the conditioning of fear by systematic desensitization. This is called exposure therapy in fearful activities for children. And normally in therapy sessions also, therapists will teach this type of exposure therapies. Particularly in even OCD also, this type of desensitization system they will follow. Any doubts, sir?
No, sir.
Sir, for phobias also we can use systematic desensitization.
Yeah. Phobia, fears, both. Some children will have looking dogs fear. Some children will have from about the heights. Some people will have fear about flying in aircraft.
Water phobia.
Water phobia. Many phobias are there.
Yes, yes, sir.
Slowly, by making them desensitize about their fear, slowly we can attend their phobias or fears through exposure.
Exposure only. Yes, sir.
Where we are getting fear, there only we have to expose the person in systematic way, systematically desensitize the fear. So in hierarchy manner, the lowest fear thing only, first we will expose. After saturating at lowest fear, after neutralizing the lowest fear, then only we will go to next fearful thing. Okay?
Nice, sir.
Yes, sir.
So this is one type of behavior modification technique. And the second one is in the same counter conditioning, aversion therapy. Aversion. Aversion therapy is when the behavior is changed by replacing a pleasurable experience with an unpleasant experience. Anybody explain about aversion therapy in real life?
Substance abuse, sir.
Huh?
In alcohol, disulfiram we mixed for that substance.
Disulfiram, can we mix?
Yes, sir. For alcohol aversion therapy.
How you know? Have you seen anywhere?
No, sir. In our books only, sir.
Okay.
You are only explained, sir, in our books only.
No. Actually, in this, particularly in de-addiction centers, for alcoholic people, they will try to create aversion. Because taking alcohol is creating very pleasure for them earlier. Okay?
Yes, sir.
So, by taking alcohol with some mix of disulfiram, it will create some aversion. That means earlier the alcohol is creating very pleasure. Now it is creating unpleasant experiences. So normally people will move away from unpleasant experiences. When it is continuously creating unpleasant experiences, so they will try to avoid the type of behavior. See, drinking is also a behavior. So there, okay, aversion therapy they can use, but disulfiram or some other thing they may use. But as a psychologist, we should not suggest anybody to use disulfiram directly in the house. Or to family members, you can put some disulfiram in the alcohol, give to the family member, they will stop drinking. That type of thing we should not do. But
no,
it should
only just I said example.
It should happen in the presence of doctors. In de-addiction centers, there are medical doctors are there. If any side effects has come, they will take care. That is the reason it should happen only in de-addiction centers, I am suggesting. Otherwise, even if you are a doctor, you can allow to use. So this is one behavior modification technique is, one is systematic desensitization, another one is aversion therapy. And aversion therapy can be used even not only alcohol, smoking. Smoking is also becoming nowadays very big addiction, no?
Drugs also, sir.
Huh?
Drugs also, sir.
Drugs, cigarettes, alcohol, but andukane, that is the reason I am saying people those who are more addicted for particular habits. So it is better to consult the de-addiction centers where we are having specialists available. Only our job as a psychologist is, if they come to us, we can refer them to the one good de-addiction center to a good doctor.
Yeah, available, sir, in Hyderabad.
సార్ ఒక చిన్న డౌట్, టీది కూడా ఒక అడిక్షన్ అయినా సార్? టీ తాగడం కూడా
ఇవన్నీ స్టిమ్యులెంట్స్ అమ్మా. సిగరెట్, టీ,
Sir.
కాఫీ, చాక్లెట్స్ ఇవన్నీ కూడా స్టిములెంట్స్.
Sir.
ఇప్పుడు మనము కంటిన్యూస్లీ వర్కింగ్, బై కంటిన్యూస్లీ వర్కింగ్ వీఆర్ లూజింగ్ అవర్ ఎనర్జీ అండ్ వీఆర్ ఫీలింగ్ బోర్ అనుకోండి. సో వీ నీడ్ సమ్ మోటివేషన్, అంటే మోటివేషన్ కావాలి కదా మనకు మళ్ళీ ఫర్దర్ వర్క్ చేయాలంటే. సో
sir.
ఇన్ దట్ కేస్ what we are following different methods. Some people are smoking, some people are drinking tea, some people are eating chocolates, some people are going out and chatting with others for few minutes and coming back. One way of relaxation.
So they feel like energy boosters.
Yeah. But nothing should become a addiction.
Sir.
Some people are taking tea in 8 hours working time 2 times, but some people are taking number of times. But it is not good, no?
Sir.
Some natural stimulants somewhat okay, but artificial stimulants is very bad, no? Now for avoiding of smoking, this electronic cigarettes has come. Those things are creating very, very big problems nowadays.
How we can avoid drinking tea, sir?
No, no, not avoid, just you manage number of times.
Sir.
See, total avoiding is different and managing is different, no? Managing is a skill. That skill, I think people are having. Self-control.
Yes, sir.
Okay?
Okay.
Sir,
Okay, sir.
reducing step by step. Sir? Reducing step by step, is it correct, na sir?
Okay, in alcohol, we cannot ask them to stop immediately. But in tea, we can reduce number of times immediately also. Instead of taking 10 times a tea, this month I will take only 5 times. Next month I will take only 3 times. Like that, slowly, gradually, you can reduce. Your body also will get addict for that. Adjust for it.
By controlling.
Self-control. Even
Self-control
self-control,
is more important too. Yes.
that cravings will be dominating you, na?
Yeah.
Psychological cravings. So because of unable to control psychological cravings means that withdrawal symptoms will come in the people. So that is the major problem. Only gradually you can control this liquors, cigarettes, and tea taking or coffee taking, anything, any stimulants, slowly, gradually. That is also like a desensitization method only you have to follow. Step by step.
Okay, sir.
Suddenly, if you stop, it means problems will develop unnecessarily. Psychological problems will come. Okay?
Okay, sir.
And reinforcement response steps. So, in behavior management, this reinforcement theory is developed by the first one we have discussed about this Ivan Pavlov theories. Both are related to. And now we are discussing about B.F. Skinner, operant conditioning techniques. In your book also there is operant conditions, na? Operant conditions. Anybody?
Yes, sir.
This reinforcement techniques, reinforcement responsive steps is with a B.F. Skinner method of behavior modification techniques. So there are several methods by which behavior modification therapy functions. Basically, desired behavior is rewarded and negative behavior is punished. This is the theory of B.F. Skinner, operant conditioning theory. Somebody is talking. Okay. What here in reinforcement techniques, the B.F. Skinner operant conditioning techniques having basically 4 types of techniques are there. One is positively reinforcing. For positive behavior, we will give reinforcement, means giving some prize or giving some treat. All these things comes under positive reinforcement. And the second one is Negative reinforcement. Negatively reinforcing. And next, positive punishment. And the fourth one is negative punishment. So these are all the techniques in for children's, particularly in school areas. They adopt most of this type of things. Today, what is the next class you are having?
Lifespan and development now.
Okay, you are having how many classes further? Only tomorrow, no? Last.
Tomorrow is the last class, I think, sir.
Tomorrow is the last.
Yes, sir.
They have only one class, sir.
After this, only examinations you have to attend.
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
I think total, as per university schedule, tomorrow is the last day.
Yes, yes. Last day
Classes
only.
Yeah.
Sir, excuse me, sir. If asked about these reinforcement responsive steps or the behavioral counter conditioning and all, should we write along with case description, sir? Like in the textbook, they have given case description.
You have to write according to question. You have to write what they have asked. They have asked in short form questions or long form questions. But in any question, description you have to write now. What is behavior modification?
We have to explain what that modification is. A reinforcement responsive step. For example.
Behavior. The description, the definition you have to write. What is behavior modification? After writing, what are the theories available for behavior modification? One is classical condition theory. Second one is operant conditioning theory. So that theory was proposed by Ivan Pavlov. That dog goose elevation problem is there now. If the elaborative question means you have to write. And here B.F. Skinner theory is it is works under reinforcement and punishment. In reinforcement, two methods are there. In punishment also there are positive and negative punishments are there. And some technique also you have to write. Example, you have to write. In your book, everything they give.
As an example, after writing this, we have to write as an example the case study.
Yes.
Okay.
Tomorrow we will discuss elaborately because here some my room civil works are going. They are making some noise. Only another 10 minutes time is there. Now this time, 10 minutes time is for question and answers. Anybody want to ask any question, please ask. Tomorrow we will continue the class. Don't worry. How many topics are left over now after this? Any idea?
2, 3.
See, this is now we are discussing this behavior therapies is 21.
Two topics, sir. 23. Unit 23 is our last unit.
And 22, 23, there are two topics. Tomorrow I will discuss those two topics. And this behavior therapies, particularly the reinforcement onwards, I will discuss tomorrow. Don't worry.
Society's response to maladaptive behavior and the change of prevention.
Challenges of prevention.
Okay, those are all only general topics we will discuss tomorrow. And I hope you all students understood very well this psychopathology.
Yes, sir.
Yes, sir. With examples, you give good knowledge, sir.
But the problem here is the time constraint. Actually, for a good explanation, we need lot of time. Lot of examples are available with me. But I am unable to explain all the things because of time constraint. Only 8 classes or 16 classes. That is only the problem. Anyhow, you are all master students. You can understood by reading books. Don't worry.
Sir, కొన్ని టర్మినాలజీ అర్థమవుతలేదు సార్.
మీకేం అర్థం కావట్లేదు, మీరు నోట్ చేసుకోండి. నోట్ చేసుకుని యూ డిస్కస్ విత్ సమ్ ఎక్స్పర్ట్, సమ్ ప్రొఫెషనల్. ఒకవేళ మీరు నాతో డిస్కస్ చేయాలనుకుంటే కనుక ఐఎమ్ ఆల్సో అవైలబుల్. యూ కమ్ డౌన్ వన్ డే టు మై ఆఫీస్. You can have discussion. You please note down before coming to me.
Okay, sir.
Because ఇక్కడ ఏమంటే మనకు టైం షార్ట్ ఉన్నది. We can't discuss each and everything.
Okay, sir.
Okay? Like that, I can help you. Don't worry.
Thank you, sir.
So,
previous questions papers are available, sir.
Previous question papers I am having.
Please send me, sir, group.
No, I cannot send anything in our group.
Sir, at least could you share in the class, sir, tomorrow? We'll take screenshots for that papers.
At least one question paper I can show you tomorrow.
2 years, 3 years papers.
Because all the question papers are available in university, library or someplace that you have to plan well in advance. If you are having any doubt how the questions will be, you have to collect everything from university. See, we are all private people. We are not a staff of the university. Try to understand. We cannot cross our limits. We are having certain boundaries.
Yes, sir.
Okay.
If anybody really wants, just try to meet me. I will definitely give some help. But Monday, Tuesday, I am not available. Remaining days, I am available. If anybody want near to me, they can come and take help. No issue.
Okay.
Okay, now another 7 minutes time is there. We are concluding today class. Tomorrow we will meet by exactly 1:30.
Okay, sir. Thank you.
Thank you, sir.
Okay, thank you, sir.
Thank
Thank
you.
you, sir.
Thank you very much.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you.
Thank you, sir.
Nice.